Good morning, I'm Mabel Jong, and you're watching the first day of the World Healthcare Congress here in Washington, D.C. We have in our interview studio Randy Oostra, who is President and CEO of ProMedica Health System in Toledo, Ohio. Good morning to you.
Good morning.
Well, tell me a little bit about ProMedica. You have 14 hospitals in your system now?
Right, so we are a traditional integrated delivery system. So we have 14 hospitals. We employ physicians. We've employed physicians for 25 years. As others got out of it and got back in, we've stayed in it for 25 years. So we have about, I guess, closer to 900 employed today and about 2,500 physicians we work in throughout our system. And then we've had a health plan that has takes risk in all products, if you will. And we have about 330,000 lives today in our health plan. So very traditional, some post-acute services, largest employer in many of our communities. So given our location, we're in Northwest Ohio and Southeast Michigan because we're right on the border. So it's a service area that works for Toledo, and again, just a traditional system, about $3 billion in revenue, about 100,000 admissions a year.
Okay. It's interesting, when I was looking at your system, you've taken on some social issues also that you address,
Right.
Such as hunger and behavioral health and affordable housing. Why take on those issues as well?
You know, a lot of it had to do, I think, kind of post-Affordable Care Act, and you kind of, anytime major change comes, you step back. And, you know, as people clamored to talk about, you know, well, we need to have value-based, purchasing, and we're going to get paid for value. And really this notion of that, it was all about the payment cycle, and so much of healthcare we define in terms of payment and business, which really, if you think about it from a national perspective, $3 trillion that we invest in healthcare. We know all the issues in healthcare. Number one cause of national debt, number one cause of personal bankruptcy, people not being able to afford care. And then you begin to talk about, well, we're just going to change the way we reimburse and it's going to fix things. And even though the Affordable Care Act did some great things and provided coverage for more people, it really didn't address the fundamental model. And the fundamental model is still really based on this notion of continuing on the way we are, except, changing how we pay people. And, given the history of healthcare, we'll figure out what that is and we'll continue to keep payments. And then you look at the percent of the GDP, 17% predicted to go to 19 to 20, and this notion of that we can't afford this $3 trillion system in our country, so something has to change. So as we started looking at it relative to the type of things we do, traditional integrated system, doing the things that many people are talking about today, like starting insurance plans, taking risk, well, we've done that for 25 years, and our notion is, well, that really isn't the answer to the healthcare problems in this country. So we got very interested in the social determinants, and a lot of it's based on the notion that of your health, very little is really based on your clinical, experience. Think about it, you don't hang out in hospitals or doctor's offices. So about 25% of your health is really related to this clinical part, and 75% is related to social issues, probably the zip code where you grew up in and the things around you, the opportunities you had in life. So we continue to spend $3 trillion on something that we know has significant issues as far as ineffective care, and yet people's overall health and well-being, if you look at people's well-being, it's really related to the social determinants of health, hunger being one of the primary drivers. So it's kind of a long story how we got into hunger, but kind of the bottom facts are 14% of Americans are food insecure. That means there's times during the month they don't have food on their table. 19% of homes with kids, 33% of single moms and kids. So if you just think about that for 10 seconds, 33% of moms and kids have times during the month where they don't have food, or they're worried about food or running out of food. Same sort of numbers for seniors, and seniors won't necessarily report it because they're worried about independence. So we have all these issues related to people being hungry. And the traditional idea in healthcare is, well, that's not our problem. But hunger is a significant health issue. And if you want to portray it as a welfare issue, it gets to be very political. But it's a fundamental health issue. Everything from the expecting mother to the newborn child, and those health aspects are huge and have an impact on their whole life. So we got very interested. We started with food reclamation. We screen all our inpatients and soon outpatients for food insecurity. There's questions you can ask. Provide short-term food needs. We built an inner city market, very focused on that. Mental health, 60% of adults go untreated with mental illness in this country, 40% of kids. It's completely outside of the healthcare realm. It's not integrated, it's fragmented. Same thing in housing, same thing in employment. We have some real issues in infant mortality in Ohio. So we got very focused on social determinants.
What's the key message you want to leave with attendees at this meeting this year?
Well, you know, we believe that healthcare needs to take a much larger role in these social areas. And we can spend $3 trillion on things that we know are unproven, are ineffective and inefficient in variation in healthcare. But most of healthcare, largest employers in their community, tremendous resources, many of them nonprofit. So why wouldn't we begin to have them do more of the public health and social needs of our country? So most people would say, well, we don't have the money to do that. Our experience is it's not about money. It's about attention. It's about attitude. It's kind of the hearts and minds of people that are in governance and leadership. And there are things we can do and take a larger role, both as participants and at times leading, to get at some of these social determinants of health.
Okay.
And so we hope people will do more. We'd love to see Congress through CMS mandate that every patient be screened for food insecurity. And the reason we like that is it's a simple thing to do. It's an important thing to do. It's one thing healthcare could do. And it's a great beginning start to think about the notions of poverty and how poverty impact people. So you can spend $3 trillion on the current model, 3,000 lobbyists in healthcare continuing to lobby for more reimbursement, or we can begin to try to change the model, which, you know, the Affordable Care Act did little of. I mean, provided great access, but has done some things to change the model. We think we should do more, and we think doing some of these basic wellness sort of social determinant areas would be great if we could begin to do that from a healthcare perspective.
Okay, Randy Oostra, thank you for stopping by today.
Thank you. Appreciate your time.
And I'm Mabel Jong. Thanks for watching.